Welcome to the Neurology Nook. I'm back today with Dr. Modi, and we're here just to have a chat about Alzheimer's. So, Dr. Modi, for our audience, let's just start high level. What is Alzheimer's?
Alzheimer's disease is the most common neurodegenerative disease that's mostly age-related, and it leads to loss of neurons throughout the brain. So patients lose their cognitive performance in different cognitive domains, and it's progressive, so it gets worse over time.
Oh, wow. So, can you tell me what you mean by loss of neurons? We hear a lot about maybe the proteins like amyloid and tau. I'm sure we'll get into how those play a role in Alzheimer's disease. But tell me more about what you said about loss of neurons.
So the exact pathophysiology is still a little bit unclear, but what we see is there is deposition of this toxic protein called amyloid outside the neurons. And within the neurons, there is this protein called tau protein. It accumulates. And these two proteins are kind of toxic to the neurons, and the neurons undergo cell death.
Oh, wow.
And this process is progressive. So over time, these proteins accumulate throughout the brain and the neurons continue to die. Actually, you need a substantial number of neuronal loss before you actually start seeing symptoms of Alzheimer's disease.
Oh, I want to talk about that. So there's this idea floating around about cognitive reserve. And that is like the more things that you know, the more skills you build, the more novel experiences that you have in your life, the more brain connections you make. Do you feel like that applies to Alzheimer's disease? Is it that Alzheimer's will impact you less or take more time to impact you the more cognitive reserve you have? So the more brain connections you make, the more neurons you
Absolutely.
have. Yeah. Okay,
Yes,
cool.
absolutely. More number of neurons connections
Sure.
and number of diverse connections throughout the brain that does affect how fast the cognitive decline occurs in Alzheimer's disease. So we see that people with a higher level of education, their cognitive decline is slower.
Sure, that makes sense. I'm sure that applies more broadly too to things like hobbies, relationship experiences, travel, playing Sudoku, even. Just the more brain connections that you can make in your life, the more you can kind of protect yourself from the infiltration of something like Alzheimer's.
Yes, absolutely. You're right. The most important thing is social connections and socialization.
Absolutely.
And then, as you mentioned, other things also play into role like education, academic performance, how your professional career has been, and travel. So all that factors into progress of decline.
Wow, that's super interesting. Well, I can't believe the thing that you said about the amyloid plaques actually causing death of the neurons. I didn't realize that that was true, although I know that we had a podcast the other day where we were talking about someone where the amyloid plaques can cause damage to the vasculature in the brain too, which can make you more at risk for intracranial hemorrhage. Is that right?
Yeah, absolutely.
Yeah.
So amyloid protein is actually the end product of protein metabolism. So, in the neurons and other cells throughout the body, there's a lot of protein metabolism going on. And towards the end of some of these biochemical reactions, you end up having this amyloid protein, which is supposed to be cleared from the nerve cells and outside the nerve cells. For some reason, in Alzheimer's disease, the removal and destruction of this protein is affected and it cannot be cleared. And it just stays there. And then if these end products stay there, they can end up damaging the brain.
Wow. And we don't really know why that happens or why they all end up accumulating in the brain. Is that right? Or do
Yeah,
we have any insight?
We do have some understanding, but we don't have a clear, complete picture of how this ends up happening.
Do you think it has anything to do with sleep? I know we've talked about before when we sleep, the cerebrospinal fluid washes over our brain like kind of waves on a beach, and it rinses out misfolded proteins, old cells, DNA that has been damaged. And if we don't sleep deep enough or long enough, that process can be interrupted or incomplete. Do you think that that could have a role in Alzheimer's disease?
Yes, absolutely. That's one of the most important things in clearance of amyloid protein. During sleep, the cerebrospinal fluid washes out some of these proteins, and there are actually studies that looked into this. People with chronic sleep deprivation or poor quality of sleep have lower clearance of these amyloid proteins.
Oh, wow.
And so sleep is one of the factors. There are some other environmental factors as well. So poor sleep, smoking, hypertension, vascular disease like diabetes, high cholesterol, sleep apnea, air pollution,
Yes, I'm hearing
all
more and more about
all
air
this.
pollution. Yeah. We know it's funny, neurology is so complicated in a lot of ways, but often when you look into the nitty-gritty of diseases like Alzheimer's, it brings you back to basics.
Yes.
Like what do we do to prevent Alzheimer's? We aggressively protect our sleep. We protect our metabolism, we protect our vasculature, and we can do this with nutrition, again, nutrition, exercise, and sleep. So back to basics for a complicated topic once again.
Yes, you're right.
Yeah. Do studies show that the incidence of Alzheimer's is going up? The reason I wonder this is because I have seen some studies that link, like you were saying, Alzheimer's to air pollution, water pollution, even chemicals that are found in dry cleaning products, sedentary lifestyles. All of these things have been increasing over the past 100 years. It would make sense to me that Alzheimer's is increasing with that. Do we have any evidence that that's the case?
Yes, there is evidence. There are studies that look for correlation between these environmental factors and the incidence of Alzheimer's disease. On top of that, the medical community is more and more proactive in detecting Alzheimer's disease as early as they can, and the population is aging. So all these factors
that's
are
true.
playing into the rising incidence of Alzheimer's disease in US.
So, what does early detection entail? Are there blood tests, or is it mostly relying on CT scans, MRIs, and PET scans to see these amyloid plaques? How do you early detect Alzheimer's?
So currently there are so many tests that you can use to detect early on, but those tests are expensive. So for example, PET scans. There are a couple of kinds of PET scans, the FDG PET scan, and there's amyloid PET scan, which looks for amyloid burden in the brain. The FDG PET scan looks for the metabolism in the brain and different parts of the brain. Like, for example, certain parts of the brain are likely to have less metabolism compared to the other part. These are non-invasive tests. And then there are invasive tests like collecting cerebrospinal fluid and looking for these proteins like tau protein and amyloid protein in the CSF.
So that'd be like a lumbar puncture.
Yes,
Okay.
exactly. These tests are invasive. Some of them needs procedure,
Yeah.
and the PET scans are expensive. So currently, most of the patients are not getting these tests.
Yeah.
So most of the time, the diagnosis is made when patient or family complains of cognitive problem, and then there are cognitive tests that doctor can do in their office. Some of the names you might have heard: MOCA test, which stands for Montreal Cognitive Assessment. Then there is a mini mental status exam. So these tests can screen you for cognitive problems early on. I think that's the most common and cost-effective method that's being used right now to detect Alzheimer's disease. Alzheimer's disease doesn't start all of a sudden.
Yes.
There is a stage of mild cognitive impairment where the cognitive performance slowly declines over time. And people who have mild cognitive impairment, every year passes on, there's a 10% chance of turning that into Alzheimer's disease. So, and that's cumulative.
Wow. So every year it
Yeah.
increases by 10%
yeah.
your risk.
Yes, every
Wow,
year,
geez.
10% of patients with mild cognitive impairment
Will
will
move
turn into
towards-
Alzheimer's disease.
Okay, gotcha. That makes sense. Gosh, well, I wish that there was a test that could show the accumulation of those plaques that was readily available to people before you would present with cognitive symptoms. Wouldn't that be great? Because then people could intervene. I mean, I guess we can all intervene right now, even without data. It's the stuff we were talking about. Making sure you get plenty of sleep, you exercise, you're outside, you're taking care of your relationships, you're having new and novel experiences, you're not smoking, you're not drinking too much alcohol, back to basics, but know that there's a genetic component. I've heard a lot of the ApoE4 discussion. Can you tell us a little bit about that?
Yeah, there are some genetic factors: ApoE4, presenilin 1, presenilin 2. So these three are the most common genes that are implicated in early development of Alzheimer's disease. So they cause Alzheimer's disease early on, before the age of 65, sometimes people in their 40s.
Jeez. So if you have a parent or like a first degree family member that has something like this, is this something you can go out and get tested for to see if you might have that disposition to, or maybe if your kids might, if you have it?
Yes, absolutely.
Yeah. Some people are calling Alzheimer's type 3 diabetes of the brain. The reason being that it is a metabolic disorder of the brain as well. So if you are more at risk for diabetes, you're more at risk for Alzheimer's. I know we talked about that in terms of vasculature. But interestingly, the more glucose that's in our bloodstream, the more glycation occurs between glucose and proteins all over the body, whether it be in the vasculature or in the brain, that in so glycating or connecting cause damage. What do you think of people using that as the slang type 3 diabetes for
Yeah, I think you can
Alzheimer's?
use something like that. So in diabetes, high glucose does damage the nerve cells as well as the vascular endothelial cells. So tiny little capillaries throughout the brain, they are damaged. So the brain overall receives less blood supply at microvascular level. So high glucose damages these two things. And then on top of that, people who have diabetes are also likely to have other risk factors as well
Yes,
related to
metabolic
lifestyle.
symptoms.
Exactly.
Yeah. So, how does the progression of Alzheimer's differ from person to person? May one person present with more like visual spatial issues, someone else present with just general forgetfulness? Can you tell us how that may show up in the general population?
Yes, so every brain is different, and different parts of the brain have different tendency to undergo neurodegeneration. Sometimes the frontal part of the brain is more affected, and sometimes temporal part of the brain, sometimes the occipital part. So basically, depending on the part of the brain that's affected, you start losing that cognitive function first. And then usually towards the end, almost all the cognitive domains are affected.
Wow. Is there a place that the amyloid plaque sort of prefers to settle?
Yes. Most commonly, Alzheimer's disease starts in the temporal lobes, which have functions of memory as well as language.
Oh,
So
so
you,
word finding difficulty, would that be something people experience?
so the memory will be affected first. So
Sure.
patients will have difficulty establishing new memories and also difficulty retrieving old memories that are already established.
Oh, wow.
And then sometimes the language centers are affected, which are also in temporal lobe. So difficulty with comprehension of language and difficulty with expression, word finding difficulties. If the frontal lobes are affected, then patients end up having problems with execution and planning. They have problems staying organized, problems focusing on a task and completing from start to end. If the occipital lobe are affected, which are in the back of the brain, then visual and visual spatial function gets affected.
That makes sense. A lot of people are worried about when their loved one is diagnosed with Alzheimer's that their personality might change. Where's personality found in the brain? Or is it just a kind of a conglomeration of places?
It
I would
does.
imagine, yeah.
A lot of your personality traits are in the frontal lobe of the brain, and so if there is a frontal lobe involvement, then you can have personality changes first. One of the first personality change is usually loss of inhibition. People start doing things or saying things that they're not supposed to.
Sure, like you get really bold in social situations. You just say what you think. That can be really hard, I'm sure, for family members to go through. So once Alzheimer's is diagnosed, is there anything that people can do to change their prognosis or even reverse their prognosis?
Well, if it's a true Alzheimer's disease, then we don't have treatments available that can reverse the progression, but they can certainly do things to slow down the progression and increase the cognitive reserve. So first of all, lifestyle changes.
Yes.
So as we mentioned before, sleep, exercise, controlling chronic diseases like diabetes, high blood pressure, quit smoking.
Yes.
Those things would be absolutely basic. And they do need to see a doctor to screen for all these chronic medical conditions. They can be addressed more aggressively.
Yeah, it sounds like aggressive management of chronic disease and again, going back to basics.
On top of that, patients should also be tested for things like do they have a systemic infection, thyroid problems, vitamin deficiencies, especially vitamin B12 and folic acid. Do they have electrolyte problems?
Oh, things that could potentially confound the diagnosis.
Yes,
basically.
exactly. Yes.
Any presentation of confusion. Maybe UTI would be on that list too.
Yes, exactly.
Yeah, okay.
Yes.
That's great to think about.
And many times doctors will decide to do an MRI brain, especially if the dementia is progressing fast, to rule out some other neurological conditions that can mimic Alzheimer's disease, like chronic inflammation in the brain, stroke, chronic brain hemorrhage. Sometimes brain hemorrhage doesn't present acutely, and there is a slow accumulation of blood on the surface of the brain that can mimic symptoms of Alzheimer's disease, progress over the course of months rather than quick acute presentation within hours.
Wow. So these patients need a really aggressive, really thorough workup to cover all the bases before we even reach the diagnosis of Alzheimer's.
Yes, exactly. So this is what happens in the beginning. The doctors will address and make sure that other diagnoses are ruled out and the diagnosis of Alzheimer's disease is established more accurately before they proceed. And then the lifestyle factors, as we talked about. After the lifestyle factors comes medications. These are the medications that raises the level of acetylcholine in the brain, which is usually deficient in Alzheimer's disease. And so medications.
Why is that? Do you know?
The neuronal loss in Alzheimer's disease occurs more commonly in neurons that release acetylcholine for some reason.
Oh, interesting. Okay. So in theory, increasing that acetylcholine could get you some
Yes.
cognition back. Okay.
Yes.
So acetylcholinesterase inhibitors. Can you give us an example of a couple of those medications?
Donepezil and rivastigmine are the most commonly used.
Is that Aricept, donazepam?
Yes, Aricept
Okay.
is donepezil. And then there are other medications like galantamine, memantine. They also help improve cognitive performance a little bit. But none of these medications actually slow down the progression of the disease. They help you with the
Sure.
symptoms,
Okay.
but doesn't affect the progression. The progression of the disease is affected by, again, those lifestyle changes. And there's a new class of medications that remove the amyloid plaques from the brain. These medications are relatively new and they're still under investigations whether they really work or not.
Sure.
They do work to remove amyloid plaques through the brain, but we still don't clearly know if that translates to actual improvement clinically.
Sure. And because we know that the amyloid plaques can make the vasculature more friable, pulling those amyloid plaques out via this drug can potentially contribute to intracranial hemorrhage. Is that right?
Yeah, exactly. You're right.
Okay.
So these medications are one of the common ones that people may have heard of is lecanemab or Leqembi. It removes the amyloid plaques from the brain, and it's interesting how it removes it. So these
Yeah, how?
medications are monoclonal antibodies. These antibodies are injected into the blood through infusion. And what they do is they go into the brain and tag amyloid plaque so that the body's immune cells can recognize amyloid and remove it from the brain. Now, during this process, there's a lot of microscopic inflammation going on in the brain. You can imagine the entire brain has a lot of amyloid plaques throughout, and all these immune cells attacking amyloid can trigger widespread inflammation in the brain. So, these medications commonly cause brain swelling, microscopic blood vessels can rupture, and as you say, sometimes can result in bleeding in the brain.
Wow. And if that doesn't happen and the medication works exactly as intended, what is the benefit?
So the medication, in theory, if it really slows down amyloid deposition and removal of amyloid, then theoretically it should slow down or stop the progression of Alzheimer's disease.
And for how long do you think?
We don't have a lot of data yet.
Well, it doesn't sound like there's any surefire pharmacologic answers yet for Alzheimer's disease. So the search continues. But it sounds like, again, it's one of those things that can start with us changing our environment and changing our lifestyle a little to try to prevent this. And then once we do, hopefully we can stave things off as long as we can with these lifestyle changes. And maybe in the future, there will be a better answer for such a devastating disease.
Yeah, totally agree with that.
Absolutely.
And there is a lot of research going on into developing these new drugs and new ways to stop the buildup of amyloid plaques and tau protein, and also removal of the amyloid plaques. So hopefully in the next few years, we will have something promising.
Well, thank you so much for the deep dive into Alzheimer's disease today. And thank you guys so much for listening to the Neurology Nook.